line. So, and with Senator Hornback coming in the room, we now have a quorum. So, clerk, please call the roll.
Senator Hornback, Senator Southworth, Senator Yates,
Present remotely from district.
Representative Bowling,
Present remotely from district.
Representative Hart,
Here, present.
Representative Mentor,
Present remotely from District 20.
Representative Cook,
Here in the room.
Chairman Meredith.
Present in the room. And I believe Senator Southworth is here as well, and you may want to acknowledge your presence, Senator, so that we can get you.
Present in the room.
Thank you very much. That being said, first item on the agenda is consideration of the minutes of August 10th, 2021. Is there a motion that they be considered approved? Motion by Senator Hornback, seconded by Co-Chair Cook. All those in favor of the motion will vote aye. All opposed vote no. Clerk, please call the roll.
Senator Hornback, Senator Southworth,
Aye.
Senator Yates,
Aye.
Representative Bowling,
Aye.
Representative Hart,
Yes.
Representative Mentor,
Yes.
Representative Cook,
Yes.
Chairman Meredith.
Aye. Motion carries. Total number of items on the agenda today are 301 in the amount of $86,867,332.36. Next is the deferred list, and let's start with number 69 from the July routine PSC green list. If representatives are here, please identify yourself for the record.
Hi, this is Robin Bender. I'm the General Counsel for the Justice and Public Safety Cabinet.
Jason Hamilton, Director of Financial Services.
Jennifer Washabaugh, Procurement Specialist for JPSC.
All right, thank you. This item was deferred from July. We did discuss it in August, but there was an appeal pending. So can you give us an update where we are with that appeal?
The appeal is still pending, and so nothing has really changed since last time we were before you.
Isn't that kind of unusual? I thought there was a deadline on a timeline when these appeals had to be resolved.
So what's happened in this case, there was a technical issue that delayed some of the filings. And so right now, the Finance Cabinet has not yet received all of the filings related to the protest. And that's why it's been delayed slightly.
So are we operating under the new contract, or are we still with the previous vendor?
We are operating under the new contract. The previous vendor, the contract with them expired on June 30th.
Do we have any idea when this issue is going to be resolved so that we can take final action?
So the protester, Access, has filed their supplemental protest, and they filed that last week, and we are preparing our response to that protest.
Can you give us some idea what the substance of the appeal is about? What's it being protested upon? I mean, obviously they didn't get the contract, but is there any particular component of the proposals that's in question?
You know, I'm a little bit wary to say too much since it is currently under protest. But the issue here is that when we put out the RFP, there were two submissions. One of those submissions was disqualified for not meeting a required element of the RFP. So there was then once that disqualification occurred, there was only one bid, and we negotiated contract terms with the one qualified bidder.
Do you think that's a little bit unusual given that the previous vendor had the contract for over a decade, I believe?
I mean, they did not submit a required part of the proposal. So I don't know what to say other than that.
Well, then are we committed to accept the only remaining bid, or should it have been rebid?
We had a qualified bidder and we negotiated a contract with them. And we were able to negotiate terms that actually were a discount. So 90% of the tests that are submitted under this contract are for the blood panel test. And we negotiated a slight discount, a 50-cent discount off of the cost that we had previously paid under the prior contract off of that test, which makes up approximately 90% of the requested tests in this contract.
Well, I'll tell you, we have a long queue of committee members who have questions, and I think what has precipitated that is the fact that the information we received said that the contract increased from $1 million to $1.3 million. And when you got a 30% increase in anything, it certainly captures people's attention. So it's surprising when you say that the new vendor has discounted prices. Does that mean they've discounted their prices that they traditionally offer? But that's still a cost that's higher than the previous vendor?
The total amount of the contract, the increase from $1 million to $1.3 million, is based on utilization. Historically, we have seen this contract, even with the prior vendor, increase over time. So each time we've renewed the contract, there has been an increase, and that's because of utilization. As we all know, with the drug epidemic that's going on, and then with the pandemic and some of the increases we've seen in substance abuse disorder during this time, there is increased utilization for toxicology testing, which is why this contract was $1.3 million instead of, the prior one had been $1 million.
Well, I guess the other question I have is, do we really have an apples-to-apples comparison? Because one of the things I've heard, maybe you can validate this for me, is that the previous lab tests that were performed included blood, urine, and vitreous testing, and that the new contract only calls for testing of blood. Is that true or not?
So we have seen the invoices from the prior vendor indicate that there were different charges for blood, urine, and vitreous testing.
Well, was that consistent with their previous contract?
Yes, I believe it was consistent with the previous contract.
Senator Southworth, I'll defer to you since you're first on the list here.
Thank you, Mr. Chairman. Let me just follow up on your question before I get to mine. The different charges that you mentioned for the different tests, does that mean in total that all of the tests together are 50 cents less, or is that just the blood test?
Just the blood test is 50 cents less than it had been previously.
And you said 90% of what you're doing is blood tests and 10% are the others?
Those are approximate, yes. Approximately 90% of the tests are the blood panel test.
And the old vendor used one charge for a set of 3, or they separated out as well?
Based on the invoices, it appears that there were separate charges for blood, urine, and vitreous under the previous contractor.
Okay, thank you. So to my original questions, we heard last meeting, which was, I would think, a full month ago, that the very next day somebody was having a meeting with finance cabinet, and there was going to be, I think it was some kind of negotiation or something to that effect. And what I'm hearing right now is that you had to put that off because finance doesn't have all their stuff together. So at what point are we having that initial meeting that was supposed to happen a month ago?
Okay, so there's two separate issues here. There's the bid protest, and that is still currently pending because their finance has not yet received all the filings. They just received the filing from the protester last week. So that's the bid protest issue. The other issue was a contract dispute with the prior vendor Access. When the contract was set to expire at the end of June, we notified Access that they requested the return of the samples that they could not complete testing on prior to the expiration of the contract on June 30th. They did not return those tests to us, And so there were approximately 200, a little bit more than 200 tests that Access retained. There were also, so we started discussing with Access and the Finance Cabinet that issue, the issue of the tests that they had not returned. During those negotiations, Access agreed that they would return the untested samples to us. That was going to be a very arduous process because of the technical requirements of preserving the sample, and they're very temperature sensitive. So I think they're maintained at like a negative 25 degrees. So it would take a long period of time for them to ship those samples back, and they said it would take months. Additionally, there was going to be quite a bit of cost to that. And so, and even once we got those samples back from Access, then we would still have to submit them for testing to NMS. So once we got all of this information and through our discussions with Access, which the Finance Cabinet helped facilitate, we realized that the best method forward for these 200 tests would be to enter into a not feasible to bid contract to get those samples tested. And, you know, again, there are Kentucky families out there waiting on these test results. These are families who are grieving. There were prosecutors awaiting these test results to pursue criminal charges. And so, you know, again, for public safety and for Kentucky families, we decided to enter into this contract to complete the testing of those approximate 200 samples that Access had maintained.
Okay, thank you. So when did those tests, did that not feasible to bid contract get going, and the tests were tested now? Or, I mean, because one of those families is my constituent as well, and I'm wondering, when are we going to get answers?
So it's the contract, the not feasible to bid contract was finalized last week. And my understanding, Access said they would immediately start testing those samples, and they would complete that testing by October 31st.
Okay, and back to the original question about one bidder and one disqualified bidder. It might be a question for you, maybe any other council can help me, but does 45A require us to negotiate with a single bidder if there's only one bidder?
We followed the procurement rules and the statutes, and we negotiated the contract with the one qualified bidder.
Okay, that wasn't my question. I wanted to find out, does 45A require that?
I don't know that it requires it, but it allows for it.
That was what I wanted to hear. Thank you.
Senator Hornback.
Thank you, Mr. Chairman. Why was in the past the medical examiner's office has been a part of the RFP, getting the RFP together and negotiating the contract? Why was the medical examiner's office not included this time?
The medical examiner's office was included. Additionally, in the past, there has not been an RFP. Access held this contract for 14 years, and which was one of the reasons why the Justice and Public Safety Cabinet thought it was important to go through the procurement process and put out an RFP. And we did include the medical examiner's office in that process.
Okay. I've heard different, but anyway, where are we at on testing now? And I guess the testing now is being done through NMS?
Yes, any new tests that come in are going to our current vendor, which is NMS.
How up to date are they on those tests?
I don't actually have that information.
30-day turnover?
I'm not sure. I don't know, Jason, if Jason has that information or not, but I do not know the answer to that question.
And going back on a previous question from Senator Southworth, in talking about the pricing, it's my understanding, I've been told, that Access did the blood, the urine, and the vitreous test for one price. And in this contract, NMS charges a price for each test that's done. You said that looking at the invoices, it appears that they charge different price. Access charges different prices for different tests. Now, when you look at an invoice, it doesn't appear to be that way. Either it is they charge for extra tests or they did not charge for extra tests. So which is it? It's not an appears thing. It's either they did or they didn't.
There are separate charges for each test on the prior invoices that I have seen.
Okay. And so the new lab is $107 a test, is that right?
For the blood panel, yes.
Okay. Okay. I just think it's a shame that, we still got these tests that are hanging out there, like Senator Southworth said. She had a constituent that was affected by this, and it's a shame it's taken this long to do that. And I understand why it was going to cost so much to get the samples sent back to the office, then forward them on to NMS, and why we're letting Axis do that under no bid contracts, which I think is probably the right way to go. But it seems I'm hearing just a lot of discrepancies, about what's going on and what's going on. And the one thing, I don't think the medical examiner's office was notified and included, for what I've been told pretty direct, about what's been going on. So thank you, Mr. Chairman.
Thank you, Senator Hornback. Co-Chair Cook.
Thanks, Mr. Chairman. I just want to bring this to the real world. And while we're sitting here and we're squabbling, we've got Kentucky families that are actually out there suffering for this. And I believe it's been testified before us before that there was no backup, yet Senator Southworth, we all continue to hear from our constituents that there is indeed a backup on this. This contract's been deferred twice, and then we're sitting here today, and I'm hearing a different spin on it than what we've heard in the past. We need to instill a sense of urgency and quite frankly, some common sense under this contract to resolve this and help the constituents of Kentucky. That's all I got, Mr. Chairman.
Thank you, Co-Chair Cook. I guess one final question. You just made a statement that Axis had this for 14 years, and this is the first time we bid this contract in 14 years. Is that correct?
I believe that's correct, yes.
Why did we wait 14 years to bid this contract? What precipitated that?
I can't answer that question. I've only been here since January of 2020. So I know that when we came in and saw this contract and realized that it was going to expire, we started developing an RFP to bid the contract out as soon as we could. And the medical examiner's office was included in that process. They reviewed the RFP, they provided information to us in generating the RFP. They reviewed the sample kits that were provided by the bidder and approved those, and they also approved the contract terms.
And again, you can't really tell us why the Axis proposal was not qualified?
Well, it is the subject of the bid protest, and the most that I feel comfortable saying at this point is they failed to provide a required element of the proposal.
Is there not a provision for any company to correct their submittal?
We had two proposals, one that complied with all of the requirements of the RFP and one that did not. So the bidder that did not provide the required elements was disqualified.
I appreciate that, but that wasn't my question. I'm saying there's no provision within your guidelines to allow a bidder who submitted a bid that obviously was incomplete to correct that deficiency?
I was not part of the scoring committee, so I cannot really speak to that specific question.
Well, I think, just in terms of fiduciary responsibility to the Commonwealth to make sure we're getting the best price and best contract, wouldn't that make sense? particularly with a vendor that's done this for over a decade.
So I'll speak to that. Again, when we think about the RF process and we think about, the intent of 45A, I think, I'll speak for, the folks who I've worked with here in this cabinet. We hold 45A to the utmost, highest respect. And so that process, doesn't lend itself to having modifications if mandatory items and a process is illustrated in an RFP out to vendors. I think it opens up doorways that we don't necessarily want to go down.
Well, holding 45A in the highest regard, respect, as you said, I guess that depends on who's hogs and who's cabbage patch, because you've already extended this contract. We haven't had an opportunity to really review it and say yay or nay on it. So you're saying you're consistent with 45A with the exception of getting legislative approval? Does that have no value, no purpose in this process?
You do have an opportunity to approve this contract. It currently is under protest, so that's why it has been deferred twice. But this contract is before you, and will be before you after the protest.
Co-Chair Cook, you have another question?
Simple question. What was specifically omitted from the RFP application?
Again, this is under protest, and so I don't want to go into too many details of that protest at this time, but they did omit a required element of the RFP.
Anything else, Co-Chair Cook? Senator Southworth?
Again, does KRS 45A prevent or privilege information that relates to a protest if it was in an RFP that was an open record at one point?
Actually, the RFP itself is open, of course, but the responses and the bids that we have received are not open until the contract has been made final, and currently it's under protest, so those items are not public right now.
Okay, then let me ask an easier question. We're in a public meeting right now, but does our staff have access to that?
Have access to the RFP?
From an agency to agency information sharing process that's not necessarily open to public.
I do not believe that we can provide the proposals to you at this time.
Okay, thank you.
Well, obviously, since this is still pending, we can't take action on it. But, I guess my closing thought is I reported to a board of directors for over 35 years. And one particular director was fond of saying, a decision doesn't have to be fair, but it has to have the appearance of being fair. And this one certainly is deficient at this point in terms of whether this is fair or not. And obviously, we've got a lot of questions. I think when you come back next month, hopefully this matter can be resolved. But I think we'll probably have more questions then. But appreciate your participation this morning, and we look forward to talking with you, I guess, in October. Thank you.
Thank you.
Motion to defer, Mr. Chairman.
Motion by Senator Southworth to defer, second by Co-Chair Cook. All those in favor of the motion vote aye. All opposed will vote no. Clerk, please call the roll.
Senator Hornback. Senator Southworth.
Aye.
Senator Yates.
Aye.
Representative Bowling.
Aye.
Representative Hart.
Yes.
Representative Mentor.
Yes.
Representative Cook.
Yes.
Chairman Meredith.
Aye, motion carries and contract is deferred. Second item we had on the deferred list is with the Moorhead as the vendor, and that vendor, or Moorhead is the contract, and the vendor is now registered with the Secretary of State's office. That was why it was deferred. So is there a motion to approve that contract? Motion by Co-Chair Cook. Is there a second? Second by Representative Hart. All those in favor of the motion vote aye. All opposed vote no. Clerk, please call the roll.
Senator Hornback. Senator Southworth.
Aye.
Senator Yates.
Aye.
Representative Bowling.
Yes.
Representative Hart.
Yes.
Representative Mentor.
Yes.
Representative Cook.
Yes.
Chairman Meredith.
Aye. Motion carries. Next order of business is consideration of the agenda, including the deferred list, the personal service contract list, PSC amendment list, memorandum of agreement list, memorandum of agreement amendment list, and except for those items selected for further review. So is there a motion to consider contracts review without objection?
So moved.
Motion
Second.
I believe the second was by your Representative Mentor, and motion was by Co-Chair Cook. All those in favor will vote aye. All opposed vote no. Clerk, please call the roll.
Senator Hornback, Senator Southworth,
Aye.
Senator Yates,
Aye.
Representative Bowling, Representative Bowling, Representative Hart,
Yes.
Representative Mentor,
Yes.
Representative Cook,
Yes.
Chairman Meredith.
Aye. Motion carries. We have two items under our pulled list for PSC, and we're going to change the order of this a little bit. West Kentucky University has asked to go first. We're going to grant that. It's got nothing to do with the fact that I graduated from West Kentucky University. It's just that they have another time commitment here. So if representatives are here or on video, please identify yourself for the record, and we will proceed.
Yes, good morning, Mr. Chairman. My name is John Sunnygaard. I'm the Associate Provost for Global Learning and International Affairs here at Western Kentucky.
Good morning. I'm Amy Cardwell, and I'm the Director of Recruitment and Admissions with Global Learning International Affairs at WKU.
Good morning. I'm Rita Samaras. I'm the Manager of Budgets and Resources for Global Learning International Affairs at WKU.
Thank you for joining us this morning. Representative Southworth has a question about your contract.
Thank you, Mr. Chairman. I am entirely aware of the international student community at a number of our schools, but I have a few questions relating to spending taxpayer funds from Kentucky to recruit international students to attend here at our publicly funded universities that we primarily set up, at least I thought we set up for the purpose of our Kentucky students to get an education. So my first question is relating to the financial side. How much are these international students paying, and is this like a fundraising effort because they pay more than they cost, or what is the financial aspect of this?
So speaking strictly from the financial perspective, international students are paying about 2.5 times the tuition of a Kentucky resident.
Okay, and so you're saying that since Kentucky residents get a lot of scholarships, are we not educating them under cost, or are they paying costs and the international students are 2.5 times cost?
You know, frankly, I am not aware of the exact cost to educate a Kentucky student versus educating a student who is not being supported by the state of Kentucky. But I would like to point one thing out about this particular contract. The payments for this contract do not involve any state funds. The payments are coming directly from the international student tuition that then goes to pay a modest amount, one-time payment to agents who assist us in the recruitment process.
Okay, that sounds fantastic. So what I'm trying to get to the bottom of, though, is if we're educating our Kentucky students under cost, then potentially the international students would help us fill those holes, and therefore siphoning some of it off for international students, it's a cost-benefit analysis. And I'm trying to get a handle on what that cost-benefit analysis is, and I'm not sure if we're missing the key component, which is how much does it cost to educate the student, that we can even make that. But I would like to hear more from the financial perspective, how we came to this understanding that recruiting international students helps our Kentucky public universities.
Sure. I think there are several dimensions to that question. And this is being asked of public universities around the country, and it's been asked for a very long time. One is that frankly, higher education is a major export for the United States. It's about a $35 billion industry. In 2018, higher education was Kentucky's 5th largest service export. So that is one financial benefit that comes into the state of Kentucky. These students not only are paying tuition, but they're also paying for accommodation. They're buying food at our restaurants and grocery stores and so forth, and making contributions to the community. And of course, you know, they're paying whatever appropriate taxes are associated with that. In terms of the cost benefit of funding or of the cost of education for a Kentucky student and an international student, I really don't have that answer. That's a very difficult answer to come up with because just the complexity, but we do our best to ensure that the tuition would be exceeding the amount that it costs to educate a student for international students.
Well, thank you. I appreciate it. And I will be first to say I never am much a fan of hard data when you can't get your fingers on it, because sometimes we just can't tell and we have to take a whole pool and kind of guess and go. But I would like to hear a little bit more, perhaps in the future. What is the total pool, perhaps, since we're talking about $250,000 for recruiting, and you said it was a small piece out of the tuition dollars? How much tuition total? That's a data piece we could know. Do we get from our international students there?
Let me just explain a little bit about this contract, because that $250,000 is, I think, quite misleading. As I mentioned, the contract, let me go back a little bit. One of the tools that we use to recruit students outside the United States is we work with agents who are based in communities all over the world. They have direct contact with students. We work with many different agencies. Those are listed here in the document. Last year, for example, and we pay $2,500 per student to an agent who comes through this. We pay that money after the student has enrolled at Western Kentucky and after they have paid their tuition. So their bill is fully paid before we make any payments to any agent. So last year, 2021, we had one student who came from agents. This was a graduate student. He paid approximately $17,000 in tuition for 1 year. He'll be paying for 2. And we paid $2,500 to the agent who recruited him into the university. We've set the amount at $250,000 in the very optimistic hope that we are able to recruit a larger number of international students into the university.
Okay.
So we're not spending $250,000. It's a pass-through, and that is the amount that we're asking to be able to have the authority to spend in the event that we recruit that many students.
Fully understand that and apologize for not having reviewed the full contract before, but I'm sure you can understand we have hundreds, so sometimes we go by the synopsis here. That does help fill in a lot of holes. Thank you.
I'd like to add to that just a little bit if I could, and maybe the same line of questioning that you have, Senator Southworth, because I had this discussion with President Cavoni right after he took office. And reminded him that I went to Western Kentucky University because I knew I could get a quality education at a very, very affordable price. At least back in the late 60s and 70s, that seemed to be the major focus of our regional universities, is to provide an educational opportunity to people within Kentucky at the lowest possible cost. As we know, we've seen astronomical increases in tuition cost over the last 30, 40 years, and doesn't seem to be abating any. And I was aware that Western had developed a very strong international studies program. And my question for him is, if we're committing resources to a program such as that, the sole intent of bringing people in from outside the United States and obviously Kentucky, is that diverting resources away from things that really this state needs at the present time? As you know, we have a tremendous labor shortage, most notable in education, which Western's always had a strong reputation for developing teachers, but also healthcare. So while this appears to be a very strong market for our universities and a profit center, is it doing so at the expense of these other programs that maybe are more vital to the state of Kentucky than international studies? Is that a fair question?
Yeah, and I would be very happy to respond to that, Senator. First of all, we have very few international students who are registered in undergraduate teaching programs. Because the licensure and so forth, they must go through the Kentucky licensure. And frankly, the international students are coming with the intention of returning to their home country. So at the graduate level, yes, we have several international students, but they are definitely not keeping the American students out of the Kentucky students out of the classrooms. And in fact, they're helping to keep some of those graduate programs going. On the nursing side, because of the regulations and the very high standard for English language to do one's clinical work while they're studying, we have virtually no international. I believe there's one international student in the nursing program, and that is not to suggest that we have a low standard for English, but for nursing, it is considerably higher than it is for any other program. And so again, these students, by the revenue that they're bringing in, albeit small, are making a contribution to helping to keep the tuition affordable so that Kentucky students can participate in some of these really critical majors that you pointed out.
I appreciate that explanation, and let me restate it as a crude capitalist, is that we recognize this as a profit-making venture that is used to help to subsidize the education of our fellow Kentuckians. Is that a fair statement?
Yes, it is. I believe there's significantly more to that, but from a strict and narrow financial perspective, yes.
Well, it's a business model, and again, I hate to be crude about it and crass about it, but that is what it is. And I wasn't suggesting that we were training teachers and nurses to return back to their home countries. My concern was we were using resources to sustain an international studies program that could be used to expand the number of slots that we have for teachers and for healthcare workers specifically. But you say that is not the case, so I take that at face value. But Senator Yates, you have a question or comment?
Mr. Chair, that was from the first speaker when we first began. It was just sitting in there. I had also put the button to raise my hand, but it wasn't noticed. Not a big deal. No questions on this, Speaker.
Our apologies, Senator Yates.
No worries. I know it's difficult with the Zoom.
Any other questions, comments regarding this contract? If none, is there a motion to approve it?
So moved.
Motion by Representative Mentor, seconded by Co-Chair Cook. All those in favor of the motion vote aye. All opposed will vote no. Clerk, please call the roll.
Senator Hornback. Senator Southworth.
Aye.
Senator Yates.
Aye.
Representative Bowling.
Yes.
Representative Hart. Representative Minter.
Yes.
Representative Cook.
Yes.
Chairman Meredith.
Aye, motion carries. And folks, we appreciate you being available to us this morning. I know you have another commitment, but appreciate your time and your explanations this morning. Thank you very much.
Thank you.
Thank you.
Next item on our pull list is with the University of Kentucky. And they're gathering their troops and waiting to come into the room. Apparently, Mr. Harden is lost in the halls of the annex, which is perplexing. Where you been? I tell you, you let a university win 2 football games, they think they're on top of the world, and you just, yeah. Good morning. If you would, please identify yourself for the record.
Absolutely. I'm Bart Harden. I'm the State Director of Government Relations. I have with me today Barry Swanson, our Director of Procurement. I believe we have 2 contracts in front of you this morning, and we will start, looks like, with Bourne LLC, if that's okay.
Most certainly, and Co-Chair Cook has questions for
Absolutely.
you.
Good morning. Thanks for being here. I got a very simple question with Bourne LLC. It's graphic design, $100,000. We've got graphic design school at UK. Can we do some of this be handled in-house?
Actually, we do a lot of graphic design at the University of Kentucky, and unfortunately, we have a very small graphic design shop of 2 people for the entire UK enterprise. We have found it's more cost-effective if we contract this out on an as-needed basis, and let me give you an example of some of the work that these folks are going to do under this contract or have done in the past for us. They produce a lot of campus-wide banners, brochures, other direct mail pieces, whether it be student recruitment, student follow-up, that type of stuff. They do large one-time, time-sensitive publications like annual reports, patient guides for the hospital. They recently did a publication for the Department of Surgery's annual report. They produced a new NICU guideline book, an EICU recruiting and sales kit presentation. They did a marketing transplant kit for potential transplant patients that we go out here and market. So it's a wide variety of stuff, but it's really on an as-needed basis. So when we've got a project, we can go to these vendors and they can put a team of 6 or 8 people on it, get it turned around very quickly, as opposed to having full-time employees at the university. And we have found it's much more cost-effective to keep this department slim and use outside vendors. Back to your point, for students, I don't know how much student labor we can get on a free basis. We do have a STEPS program that employs a lot of our students, but I'm not certain we can go into a college and basically farm out work to them and expect them to do it free of charge. And I think that's the issue there. It's almost like captive labor, if you will, if we were to go that route. So I think that's how I'd try to answer that question for you.
Just tell them it's real world experience.
Well, and we do have internships and we place a lot of students, but in terms of doing actual production work for the university, I think we could get ourselves into a bit of trouble there if we went that route.
Thank you for your explanation. I
Sure.
appreciate that. Thank you. That's all I got, Mr. Chairman.
Is there a motion to approve this contract?
So move.
Motion by Co-Chair Cook, seconded by Senator Hornback. All those in favor of the motion vote aye. All opposed vote no. Clerk, please call the row.
Senator Hornback, Senator Southworth.
Explain my vote, Mr. Chairman.
Please.
I'm voting yes. I just find it hilarious that we have Representative Cook over here keeping his eyes on the graphic designs, because everybody knows that's the thing that I stick out the most with. And if we could somehow, that it sounds, I don't even want to think about all the things that they're designing over there. It just almost stresses me out thinking as if that was my work. But if we could somehow figure out how to simplify and reuse and maybe use like one vendor that can copy and paste more, or make sure that I hope this is in the contracts, I haven't reviewed all of them, but that we have all of the original files from these vendors. So when we're switching to other vendors and so forth, because having all that stuff already laid out in layers would be amazing if you're a new vendor. And we've got logos and branding. The number of dollars that taxpayers are spending for new logos and branding is just kind of gets to me. But I understand these things have to be done. So I am voting yes.
Senator Yates,
Yes.
Representative Bowling,
Yes.
Representative Hart, Representative Mentor,
Yes.
Representative Cook,
Yes.
Chairman Meredith.
Aye. Motion carries. Next contract is number 52, Dixon Hughes Goodman. And I have a question, Ms. So does my co-chair Cook, so I'll defer to him first.
Thank you, Mr. Chairman. As needed basis. It's something I'm learning to watch for, and if you could just talk about that a little bit, it'd be great.
Actually, this is a very interesting story. When we submitted this contract to you, we were in negotiations, preliminary negotiations with an entity that we were trying to forge a partnership with. During the subsequent time of submission of this contract up until today, leadership at that organization changed. New CEO and a new COO, I believe. As a result, they have become lukewarm to the deal we were trying to work on. We're not certain if this deal is going to go forward, and we're not certain if we're going to need the services of Dixon, Hughes, and Goodman in this space. What we would like to have is the approval of this contract in case or in the event that the new management comes back and decides the deal we were working on is in fact a good symbiotic deal for both of us. If they do not, no dollars will be spent with this contract. It'll just be there in place, nothing will happen. But that's kind of the history of how we got to this point today with this contract. But it is on an as-needed basis. If this deal were to go forward, we would absolutely engage these folks to help us do due diligence and accounting reconciliation and some other things associated with a partnership or merger type transaction.
Well, speaking of historical perspective, only reason I pulled this one is we've had a long-going discussion, both you gentlemen and I, at previous committee meetings about consulting agreements on an as-needed basis. And if I recall, this last year we approved close to $300 million in contracts for consultants predominantly on an as-needed basis. But you all committed that you would give us a report because they assured us, committee members, that they never spend that amount, but it's just kind of a stopgap for them. So where are we with the preparation and presentation of that report? Is it in the packet?
You should have
I'm sorry,
the report.
I have not seen it. But this is like the Swans returning to Capistrano. You know, if I don't bring this up every year, just I haven't done my job. But again, it's this type contract, and I understand where you're coming from, but I would ask, why can't we do this once this deal is close to being finalized? Because I think that's where it's supposed to work. It's just so hard.
I think our anticipation on this particular deal is that we would be ready to move into due diligence today once you approve this contract. Obviously, we've done a pretty good job at UK trying to prevent people from spending any dollars until you all act. I'm not going to say it happens 100% of the time, but we're in a pretty good place with that process right now. And I'll be here next month telling you why it didn't work. I'm certain, but I think we were, on this contract, we were anticipating we would be ready to move forward. And then again, management changed and it kind of derailed this contract. But to your point, I think you might have the numbers with you, Barry, from what we submitted.
I do.
If you want to just touch briefly on the contents of that report.
I think I appreciate that.
Just to give them an overview of, of kind of what we did. I think we did a little better this last year, but better's always in the eye of the beholder.
Well, thank you, Mr. Harden. And, you know, we did submit the report a couple of weeks ago, and happy to discuss that with you. We did do better than in the past. I can say that with certainty. I will also tell you that I'm still not satisfied with the report, and I expect you will not be either. I think there were around 37 contracts which had zero spend, which is something that I think we need to work on understanding that more. We spent, if you take in the totality, including the zero spend contracts, we spent about 40% of the dollars that were approved. If you take the zero spend out, it's about 51% of the dollars approved. And, you know, I'd like to see those zero spends come down. I'd like to see the percentage spend go up. We're significantly better than the year before, which was we spent a whopping 13%, almost right at 14% of the amount that was approved. So we're trending in a very good direction, but it's still not. You know, I think this year maybe we'll make up the rest of the gap.
Well, I think I speak on behalf of the committee members. I think we certainly would like to review this information and possibly have you all discuss it at next month's meeting. But I appreciate this follow-up and the information. The only thing that still, I won't say concerns me, but it caused me to question. And again, I appreciate that UK is our largest university, but none of our other universities have near the level of consulting contracts that UK does. And that's not a criticism of you folks where you're doing a good job, bad job. It's just there's a difference there. And I'd like some explanation, is not from you folks, got to come from somebody else's, why that is so radically different. Are we not seeing all the consulting contracts from our other public universities, or you folks doing too good a job of providing us with the information? I don't know, but it's just there's not any consistency there. And I guess your closest comparison would be University of Louisville with Jewish Hospital and University Hospital. Again, don't see those contracts for some reason.
I really can't speak to the other universities. I will tell you we're doing our best to bring everything we do in front of you. And be as fully transparent as we can be. We're a $5.2 billion enterprise, as you know, and we're large, but again, we're trying to make sure everything we do comes before this committee and give you all an opportunity to ask questions and at least have an understanding of what we're attempting to do. As far as the other folks, I really don't know the answer to that question.
Well, I do commend you that you always have been receptive to any question that we have presented. I agree with you. You've always been transparent and given us any information that we needed. I guess my aversion goes back to the fact I just don't like consulting contracts. I don't think we get our money out of it, but I'll defer to you folks on that one. But Co-Chair Cook?
Mr. Chairman, I appreciate everything. I especially appreciate this report, sitting here flipping through it, and appreciate your guys' efforts to get this right. Looking forward to going into more detail on that. But, Mr. Chairman, I move that I move to approve this.
There's a motion. Is there a second? Second by Representative Hart. All those in favor of the motion vote aye. All opposed vote no. Clerk, please call the row.
Senator Hornback. Senator Southworth.
Aye.
Senator Yates.
Aye.
Representative Bowling.
Was the motion to approve or disapprove?
To approve.
I'm a yes.
Representative Hart.
Yes.
Representative Mentor.
Yes.
Representative Cook.
Yes.
Chairman Meredith.
Aye. Motion carries. And gentlemen, appreciate you being here. Always entertain our questions, and you do a great job. Appreciate it.
Thank you, Chairman. Appreciate it.
Thank you. Next item on the pool list are with the Board of Medical Licensure, are numbers 3, 4, and 5 on the PSC Amendment Ivory list. If representatives are here, please come forward and identify yourself for the record.
Good morning, everyone. I'm Mike Rodman, and I'm the Executive Director of the Kentucky Board of Medical Licensure.
Good morning. Are you going solo this morning?
I am solo. It's just me today.
All right, Mr. Rodman. I think my question is going to be very simple. Hope you appreciate we get our thumbnail descriptions of what these contracts are for. But I notice on each one of these that contract 3, we're adding 2 new consultants. 4, we're adding 1 new consultant. And 5, we're adding 1 new consultant. So my question, are we replacing people, or are we actually adding 4 additional positions to this body of work?
We're actually adding 4 additional consultants. And usually, almost always, it's because of an immediate need, because we have an investigative case that need to have medical records reviewed.
How many people have you under contract now to review charts, records?
Probably, I think around 88, 89, somewhere in that ballpark.
So we're adding 4 additional people to that 88.
Well, that would be including that. I think that includes, yes.
Okay. And what's precipitated this increase?
It's just that we have investigations in those specialties we don't have the consultants in those specialties, or it's either that or our existing consultants have conflicts or can't review those cases for some reason.
So it's really not an issue of an increase in volume of investigations?
No. It's not a volume. It's just a lot of times it's just our existing consultants can't do it, or we don't have a consultant in that specialty at the time. Like for instance, one's like interventional radiology. We did not have a consultant in that specialty.
Are there any other specialties you presently don't have consultants available for?
It varies as you know your experience in the hospital. The specialties are all over, and hopefully we at least have one in every specialty. That's our goal. But occasionally, even when you have when you just had that one consultant in that specialty, that consultant may actually know the person. So that's sometimes we have to go out and find someone else.
All right, thank you. That's the only question I have. Are there any questions from committee members? If not, entertain a motion to approve. Motion by Senator Hornback. Is there a second?
Second.
Second by Representative Hart. All those in favor of the motion vote aye. All opposed vote no. Clerk, please call the roll.
Senator Hornback. Senator Southworth.
Aye.
Senator Yates.
Aye.
Representative Bowling.
Yes.
Representative Hart.
Yes.
Representative Mentor.
Yes.
Representative Cook. Chairman Meredith.
Aye, motion carries. Mr. Rodman, appreciate you being available to us this morning, and these contracts have been approved. Thank you.
Thank you, sir.
Next item on the pull list with the Board of Elections, and is number 2 on the MOA pink list. If representatives are here, please identify yourself for the record.
Good morning. Karen Sellers, State Board of Elections Assistant Director. On Zoom with us is Rachel Pointer, our Fiscal Officer.
And Taylor Brown, General Counsel for State Board. Thanks.
And let me apologize, Jared Deering wasn't able to Zoom in with us today from his location.
I understand. No problem. Appreciate you being available to us this morning. Senator Southworth has questions.
Thank you. I just wanted to find out which equipment they have purchased and how many are in that purchase. That's my first question. We'll not pile it up.
So they have purchased and provided us with the appropriate documentation along with this memorandum of agreement. So Lewis County provided an invoice with serial numbers for 5 Verity scan bundles for a total of $31,450. 5 Verity rider bundles at a total of $27,175. So the 10 pieces of voting equipment was included for a total of $58,625. The remaining items to fill out the reimbursement total, which was a little over $61,350, was 18 Verity drives, 5 Verity keys, and secure shipping and handling to Lewis County for a total of $2,725.
The federal funds here, is this from Help America Vote Act grants, or is this something else?
Yes, it is, Senator. It was from the original grant awarded to the state in 2004.
And the agency 5% is the Lewis County Fiscal Court?
That, yes. They are making up the difference in their purchase. We had a...
that 5% is paid by the
state.
The State Board of Elections.
Right. That is our
State Board
match.
of Elections.
Yes.
Is matching for the federal grant.
Yes.
Yes, ma'am.
On behalf of Lewis County. And does Lewis County have other costs other than these 5 machine sets? I mean, I'm thinking they might have more than 5 precincts, but I'm not entirely sure.
That would be with Lewis County, what their their total purchase may have been something over 61,000, but they wanted to access these designated funds
And are the
from the
funds
HAVA grant.
are the funds designated based on size of the county or number and costs of machines, or how do we throw those out to various counties from the state level?
These were funds designated in 2004 under the Help America Vote Act, and I believe it was done by precinct numbers. Am I correct there, Rachel?
Yes, the allocation was divvied up at $4,500 per precinct at the time of the 2006 general election.
4,500. I'm sorry, we started to miss a couple of your words.
I'm sorry, it was $4,500 per precinct at the time of the 2006 general election.
There we go. Okay. And that is, how often can people access these funds to get new equipment and systems?
Upon the original allocation, the counties could request for reimbursement at any time, provided the serial numbers and the proper documentation of the purchase. Once they've expended that allocation, it's no longer available. Lewis County just happened to not use theirs, and this is how much they have left to expend at this point.
Okay, I gotcha. Thank you.
Any other questions? Not entertaining motion to approve.
Second.
Motion by Senator Hornback, seconded by Co-Chair Cook. All those in favor of the motion vote aye. All opposed vote no. Clerk, please call the roll.
Explain my vote, Mr. Chairman.
Please.
I'm voting no. I think everybody may be aware, if you're not aware already. I'm never going to vote yes to help bring in machines that are electronic that have so many possible ways to be compromised, regardless of certification status or whatever else. The bigger brains in our country have made it extremely clear these systems are not secure, and I'm not going to support that for our voters. Help America Vote Act does specifically say paper ballot systems are an option. I think Kentucky needs to get on board with that. Like other states, Idaho and Montana come to mind, lots of their places use a paper ballot hand counting system as their primary method of voting, and that's what we need to be doing in Kentucky. We definitely don't want to be spending additional money on things that are going to be obsolete next year. Thank you.
Thank you. Before we proceed, Representative Bowling, I'm sorry, wrong contract. We've got you in the queue. Thank you.
Thank you.
Clerk, please continue.
Senator Yates,
Yes.
Representative Bowling,
Yes.
Representative Hart,
Yes.
Representative Mentor,
Yes.
Representative Cook,
Yes.
Chairman Meredith.
No, for the same reasons that Senator Southworth mentioned. But the motion passes. I appreciate y'all being available to us this morning, and thank you for your time.
Thank you.
Next item on the pull list are with the Department of Local Government, number 20 on the routine MOA pink list. If representatives are here, please identify yourself for the record.
Good morning, Chairman. Matt Stevens, General Counsel at Department for Local Government, and I'm joined with a couple of other staff members. I'll allow them to introduce themselves.
Aaron Jones, Local Government Advisor, the Office of State Grants.
I'm Laura Redmond. I'm the Budget Manager for DLG.
Thank you for joining us this morning, and because we travel on the same celestial plane, Co-Chair Cook and I have questions. I'll defer to him first.
I'm going to let Representative Bowling step in and ask a question, make a comment first.
Yes, please, Representative Bowling, you have a question.
Thank you, Co-Chairman. Mine was really just a comment on this. It's my understanding, and I could be incorrect, but it's my understanding this feasibility study is going to look at bringing a hotel into Floyd County to be in conjunction with the trail system that's getting up and going right now. Is that correct?
Yes, Representative, that's correct.
Okay. I just want to make a comment as well that I'm glad to see that the fiscal court is using this money. The state's already made an investment into that project. And I'm glad to see that this study is going to be done to see that way they can go out and you know, go find hotelers out there and hopefully bring in a hotel that will increase revenues in that area and be a good add-on to that project. So I just wanted to speak in support of this contract.
Thank you, Representative Bowling.
I knew Representative Bowling would have some insight on that from in his area, but my question is $100,000 for a feasibility study, and then I think I've got a little more insight to what gateway to hidden treasure, but if we could get an explanation on that a little bit more, it'd be great. Thank you.
Yes, Representative, and the applicants are Floyd and Knott County. However, this project is a joint effort of 7 to 8 counties in eastern Kentucky. Gateway to Hidden Treasures is going to be a nonprofit that tries to help regionalize the tourism opportunities in that region. As former representative mentioned, the project includes conducting a study as to the feasibility of attracting a family-friendly hotel water park like Great Wolf Lodge, for example, which would serve as a destination resort, which the area is missing. They're hoping that this resort would be used as a hub to house visitors who are traveling for the adventure tourism opportunities available in the community. Then the potential resort would also highlight the different adventures and natural resources that make the region worth visiting. Also, as mentioned, they're trying to build upon the $500,000 appropriation that the General Assembly gave to KMRRA, the Kentucky Mountain Regional Recreation Authority. And they're currently working to identify and develop trails in eastern Kentucky.
Thank you.
And Representative Bowling was able to answer my question for me before I presented it. So if there are no other questions, entertain a motion to approve.
I'll make a motion.
Motion by Senator Hornback. I'm sorry, who had the second? Was that you, Representative Bowling?
Yes, sir.
Second by Representative Bowling. All those in favor of the motion vote aye. All opposed vote no. Clerk, please call the roll.
Senator Hornback. Senator Southworth.
Aye.
Senator Yates.
Aye.
Representative Bowling.
I'm a yes, and I'll explain my vote real quickly. I understand this is, you know, several counties, several fiscal courts involved in these funds. For the most part nowadays, I will say that the coal severance dollars, that there's not as many coming back. So they are very judicious on how they dole those out. So there's no doubt that they put their heads together and have found a good cause to put those dollars towards, which I'm happy to see. I'm a yes.
Representative Hart.
Yes.
Representative Mentor.
Yes.
Representative Cook.
Yes.
Senator Meredith.
Aye. Motion carries. Next item on our agenda, if I can find my notes here. On the pull list with Department of Workforce Investment is number 38 on the routine MOA pink list. If representatives are here, please identify yourself for the record.
Good morning, Mr. Chairman. My name is Michael Bowman. I'm Special Assistant to the Secretary of Education and Workforce Development. And with me today is Amanda Ellis and Jennifer Fraker with the Council on Post-Secondary Education.
Thank you. I appreciate you joining us this morning. And I was one that requested this contract be pulled. Just like some further explanation and clarification what we're attempting to accomplish here. The agreement description we received very broad in scope, and I think I understand what we're trying to accomplish here, but I'd appreciate if you give me some further explanation and clarification as how these funds are going to be used.
Certainly. So this is, as you may know, is through the Workforce Innovation and Opportunity Act's statewide reserve fund. The governor is empowered to withhold a certain amount from allotments that we can use for statewide workforce development activities. So beyond that, I'll pass it off to Amanda or Jennifer to describe the program and what it's going to accomplish for Kentucky.
So good morning. Thank you for having us. I'll get started and then definitely turn to Dr. Fraker as well. As you know, Senator Meredith, we have constantly had a
conversation about teacher shortage and workforce needs in our field of education. Before COVID, we saw a decline in those who enroll in our teacher prep programs as well as graduate. We also see that we have specific needs, whether that be needs around specific content areas, additional men in the field, racial diversity, geographical diversity, even those who have served in the military who bring trades to our schools. And so our efforts around this is to really incentivize innovation for our public schools of education, and to really think through how to go about recruiting and retaining teacher candidates in different ways than they've ever done before to meet the needs, regional needs and the diverse needs of our students. When we did go back to see what the openings were, currently they're still almost right at 1,300 openings right now. And that ranges from preschool all the way through high school, special education, English as a second language teacher, interventionist, a lot of social studies teachers now, math and science, preschool. There's just a lot of need in our state. And so continuing to do what we've always done is not meeting the demand. And so we were looking for ways to really incentivize innovation and support for our teacher prep programs to think through different ways to recruit a diverse group of teacher candidates to fill the needs, our workforce needs in our schools, especially now. You will read all the time about all the shortages of the schools and different things that they're facing. So we wanted to support that through really helping our ed prep programs think through a more long-term sustainable approach for ways that they could recruit and retain through support of folks who may not have even considered teaching before, but to really consider our field as a viable option for a career. Dr. Fraker, did you want to add anything else that I have not?
No, thank you. I think Dr. Ellis explained that well. We're certainly happy to answer any questions that you might have.
I appreciate the explanation and certainly understand and appreciate the need. I think we all do, but I guess mine is more generic. Is how are we spending $400,000? Are we adding a person who have responsibility for this? Are we going to engage consultants? So again, mine's more basic. Is how are we spending $400,000?
Sure, of course. So it is a competitive grant that is available for the public universities at this time because they tend to bring in the most teacher candidates. And so what it is it's not to pay for personnel so much, but it is to pay for support around the recruitment of the students, to think through how they can do outreach to students, but then also in retaining. So that could be additional support for ensuring that students are advised well, that they have support for the assessments that are required for certification processes or expectations, for their certification. It's really to think through the efforts of what can they invest in the students once they have them in the program, so they don't just enroll and then they say, this isn't for me, and they back out. And one of the things we have in the grant is also partnerships. It can be, obviously, we'd love for it to be the local school districts to identify the needs of those school districts. So it can be paying for the efforts to bring those folks together, to network, to really give experiences for teacher candidates. It's also open to having agreements with others. And the example that I think about right off that's happening without this fund is our military is working, or military affairs is working with school districts to help them identify veterans who have a skill set in some career and technical education tracks, and how they can get certified to meet needs in the local school districts in their local communities. So it can be partnerships through others outside of the local school districts, but that's what the funds would be used for. And that's what we are doing the competitive grant to see what the school or the public university would offer as ways to use funds. We would administer 3 to 5 of those grants over 2 years. There are 2 phases. One is the recruitment and one is the retention piece. And so they don't have to go for a full $100,000. It really depends on how many folks they're trying to recruit. It can be for less. So if they ask for less, we may be able to give more grants. But it does give some wiggle room into how can they invest in some different initiatives to really be intentional on the recruitment and the retention of those students to keep them in the program and to help them to successfully complete. So it does give some wiggle room, but it's not just to pay for staff. It's really to, it has to be around the support, the wraparound supports for those students who are in the program, who traditionally may not have chosen to ever even go into teaching, but how to really keep them retained and invested in the education field. Jennifer, would you want to add anything else to the funding specifics that Senator Meredith asked about?
No, just to recap, Senator, we're anticipating 3 to 5 awards and looking at 2 phases for the grant award period.
I guess what confuses me just a little bit is, 4 or 5 years ago, we had a lot of discussion about the workforce needs in Kentucky and how our public universities would help fill that gap. I guess I'm a little bit disappointed that you folks have to reach out to our public universities and they're not coming back to you folks and reaching out to you and say, we know there's a problem. Everyone knows there's a problem, and here's how we're going to fix it. I think they have to incentivize them to address an obvious need in our labor force for the state of Kentucky is a little bit perplexing. And don't know if you were part of the conversation or listening earlier when we were talking to West Kentucky University about their international studies program. And again, I understand the need for that program, but are we really being aggressive in addressing the workforce needs throughout the state? And again, it's just perplexing to me that we have to incentivize our public universities and colleges to tackle this issue. I would think they should be coming to us and saying, here's what we're going to do to fix it. Am I missing something here?
No, I do think there's a willingness. My hope is that we capture some promising practices to be able to share with other universities who may be struggling. The teaching field doesn't always offer the most competitive salaries for those students who have lots of options. And so I think they're really trying to think of innovative ways. Teaching, to me, I'm very biased, is the most meaningful education in general, is the position in which you contribute the most to so many folks. But it's really trying to reach out to others who haven't considered it before. I think there's always a will. I don't know that anybody's found any secret sauce. And I think since the pandemic, it's made it even more difficult. And so our hope is to be supportive around really supporting and really pushing on the innovations of how can we do it better? How can we elevate our field and provide the best workforce for our students? Because Senator Meredith, I've heard you speak many times about the importance of strong teachers with a strong education system, and our students deserve that. And that's what we really want to promote and include people who really may have expertise in the areas in which we have critical shortage to consider coming to teach and seeing what a rewarding profession it is. And so I don't think that there's a lack of will, but we're hoping to really increase the need for innovation and to think differently on who we recruit, how we recruit, and our approaches just may have to be very different. And that's what we're hopeful to learn more about and to see how we can elevate this. There are a lot of institutions who are doing different things, but we would really like to see it grow and spread. And really see it increase our number of educators to meet the supply, or to have a supply that meets the demand in our state, because it's dwindling and it has over time, and that's very much a national trend. So we'd like to be a trendsetter to really increase that and to think differently about how we recruit our future educators and folks who are in the education pipeline. And there's a lot of efforts that have gone on, but this is specific to how we can push on the ed prep programs to really even elevate their work even more. So. But we see the need too, and that's just why this was really important for us to be a part of this work.
Well, again, I agree with you 1,000%. At the same time, we've got some critical workforce shortages in other areas, such as healthcare. Law enforcement is becoming another big one that we're going to have to fill that gap for. And I appreciate your passion for this issue. I would just hope and pray that at our public university level, we have people that had that same passion and desire to rectify this problem. And again, that's why it's just perplexing to me that they're not coming to you and say, we have a problem. I mean, our public university is supposed to be staffed with some of our brightest in the state. And and I think they should be providing the leadership on this. Appreciate that you are, but again, I'm just disappointed we have to incentivize people to respond to this, but I don't want to belabor the point. Co-Chair Cook has a comment or question.
Thank you, Mr. Chairman. I want to hone in on one comment, and that's with the veteran community, veteran myself, and I really appreciate what you're doing right there. And I don't want to jump up on my soapbox yet. I want to save it for a contract that we have coming up here in a few minutes, number 61 with the state police. But they're doing something right. And I would really appreciate if you have time to stay on and kind of listen to the discussion and then some of the comments I want to say about that contract when it comes up. Thank you.
Senator
Thank
Southworth.
you. Yes, sir.
Excuse
Yes,
me.
sir.
Senator Southworth, you have the question?
Yes, this might be going back to a rudimentary question for CPE, but do we have a mission and vision statement for our public universities? I mean, is that in the KRS, or does that come out of you guys, or how do we kind of direct them? Because I feel like they're supposed to be our arms and legs, and they almost seem like they're orphan children sometimes. We can't figure out. I mean, the fact that we're even having this discussion says, you know, somebody needs to sort of lay it out what they need to be focusing on, and instead they're over here, you know, doing international student recruitment or, you know, hotel management or something that's just not a focus. But I know that you all regulate the programs they can offer, and we probably need to sit down with you and have more discussions about what we need to do to help kind of focus them in. And I'm not the person that says everyone needs to go in healthcare and education, because those are our current gaps. Otherwise, there's no innovation for the future. So I'm not saying that, but I do want to get an idea from CPE's perspective, what in the world and how do we get this controlled?
Sure. So I'll address, excuse me, Senator Southworth, I'll address what we do at the council, and we can absolutely have a work group. We can meet with you and share that, and have my colleagues who do the program reviews and approvals give you much more in-depth information. But we do have a North Star, we call it. It's the 60 by 30 goal, which is 60% of Kentucky citizens will have a certificate or degree by 2030. That is the ultimate goal. We monitor that with our community colleges as well as our four-year institutions, and that is shared out at our council throughout the year to monitor that. We have a strategic plan that we are in the process right now of updating that, and have lots and lots of stakeholder feedback. And what happens with that is that our strategic plan and our goals are shared, and we have lots of feedback loops, of course, with the universities and the community colleges to then, with their own strategic plans within their institutions, can align with the overall CPE goals and objectives of what we want to accomplish. And so they do have autonomy to develop that for sure. And I don't think they're completely off base by any means, but I mean, there is definite workforce needs, which is why President Thompson, as you may or may not know, brought Dr. Fraker and I on to connect the dots between K-12 and really improving the transition into post-secondary. We recently had a grant from the James Graham Brown Foundation to create a student success collaborative to help sustain and students succeed in college by graduating with credential degree, associate's degree, or four-year or advanced. And then we also have Rick Smith, who was recently brought on to be our connection into the workforce of really identifying workforce needs, economic development in the state, and then really being that connecting dot to the career centers and things in the universities to be intentional with what they promote and how they support students to meet the needs, the economic needs and demands in our state. I also can tell you that with the program reviews, you're absolutely right. We do approve the programs that the universities bring forth to CPE. And one of the things that they just recently have access to is that they can see that the programs they offer and the needs within the state and the return on investment for those programs or how it meets the needs. And so they just recently got access to all that very granular data, which is very, very rich and gives a lot of insight. And that was initiated by CPE well over a year ago. And the universities have recently trained and started using that as a part of their program review and approval process to determine that if it's truly a need or not. And so if that's something you all are interested in to talk further about, I would be happy to coordinate a meeting for you guys to know and see what that changes and how that really can advance the conversations. And this has all been a big piece of President Thompson's vision on how to really build out that pipeline to make it meaningful and meet the needs of Kentucky. So I think exactly what your concerns are and what you see as needs, I think we're moving in that direction and have covered quite a bit of ground. So happy to connect after this if that would be helpful for you to learn more about that.
Okay, thank you. And I apologize because Dr. Thompson's been on my list for a year to call on this topic. And obviously things keep pushing and out of the way. We'll get to that before the end of the calendar year, I promise. Final wrap up, I just want to handle, you mentioned the North Star 60/30. So that's set by CPE, your Dr. Thompson and the Brain Trust there, not necessarily in stone. So if the Brain Trust changes their idea, they could change the North Star and put that out to universities. So it's kind of a loose or unofficial North Star. Is that correct?
Yes, they put that in place. I believe when, and I apologize for not being able to tell you exactly when, because I've been on a little over a year, but it was as Dr. Thompson came on, I don't believe it was if it was directly his vision or the work of the council at that point, but it was set as the goal. And that was in partnership with the presidents of the university. So it's a well-known goal that we refer to often and with our colleges and universities on meeting that goal for Kentucky. And so again, happy to get you more information on that to give you context if that would be helpful.
Okay. Yeah, I will definitely follow up on that. Thank you.
Any other questions or comments? Not entertain a motion to approve. Motion by Representative Hart, seconded by Co-Chair Cook. All those in favor of the motion vote aye. All opposed will vote no. Clerk, please call the roll.
Senator Hornback, Senator Southworth,
Aye.
Senator Yates,
Aye.
Representative Bowling,
Yes.
Representative Hart,
Yes.
Representative Mentor,
Yes.
Representative Cook,
Yes.
Chairman Meredith.
Aye, motion carries. And appreciate you spending time with us this morning and giving us that detailed explanation, and wish you the best going forward. Please know you have our support. Next item on the pull list with the Department of Education, and they are numbers 43, 54, and 55 on the routine MOA pink list. If representatives are here, please identify yourself for the record.
Good morning. My name is Karen Worth. I'm with the Division of Budgets and Financial Management with KDE. And I also have Mickey Ray on. Mickey, are you on?
I'm here, Karen. I'm having a little bit of trouble getting my video going, but I'm good to go now. Thank you. I apologize for that delay.
No problem.
All right, thank you for being with us this morning. Let's start with contracts 43 and 54. Senator Southworth has questions on both those contracts.
Thank you, Mr. Chairman. I'm going to go in order on number 43 first, which is the literacy development contract. This is obviously a huge issue, and I'm not sure that this contract is covering the gamut, although I don't want to see our limited resources going to something that only gets there halfway, and that's why I want to ask a few questions. First, in the goals and deliverables, number one item on the contract says we're going to maintain and implement a clearinghouse for information about programs addressing reading and literacy from early childhood and elementary grades. My understanding, I just had a meeting with some constituents this week. My understanding is this clearinghouse leaves much to be desired, and that there are other states that have much better clearinghouses. Is part of the work in this contract going to be looking at other clearinghouses that are more robust than ours and maybe swapping some of that out?
So this is the work of CCLD, and talking with Dr. Ruby about the deliverables that are included in the statute. And this comes directly from KRS 164.0207. And to your point, yeah, I have been the director of the Division of Program Standards as of December of 2020. And so I know that there needs to be further work around this particular clearinghouse for those programs. And I believe this is something that CCLD will be continuing to work on and be providing with us updates around what those additional programs could be. Within the agency, though, we also promote the What Works Clearinghouse and the evidence-based approach. And there are numerous reading programs and intervention programs that are included on that clearinghouse as well. And I believe that CCLD will be looking to those other models to increase the efficiency of what is listed currently. We also are looking to promote a consumer guide specifically for reading and writing, published as of July 2022, that will include resources and tools and instruments for local schools and districts in selecting high quality instructional resources that would be aligned and that would be denoted as being of high quality for literacy within our state. So that is coming as of July 2022.
And when is the deadline to get input to you all on what needs to be in that July 2022 publication?
That will certainly be ongoing. There will be opportunities for feedback throughout the entire process. We are working with Kentucky teachers on creating that particular consumer guide. And within that, there will be review periods from different educators from different K groups across our state related to education that will be able to help to inform and shape the efficiency of that particular document as well.
Okay, so along those lines, number 5 of the goals and deliverables says providing professional development and coaching. Are we going to be getting some of these tools into the professional development? Because as I talk to teachers, the professional development is more like the gingerbread man instead of, phonemic awareness.
And so that is an issue. And for this particular contract, you'll notice if you look at the budget items, that's going specifically for reading recovery and early childhood professional development supports. Item 3 deals more with the Kentucky Reading Project that's associated with CCLD. So we are having to look outside of just this individual contract in terms of professional development supports. And I will say, in terms of the Office of Teaching and Learning, we are looking for other avenues to provide supports around those 5 key areas within the science of reading to better support teachers. And that is ongoing at this time.
Okay, and then as I'm looking at the costs here, the breakdown of the contract, we have $310,000 dedicated to the Adolescent Literacy Project, $25,000 to Dyslexia Initiative, $50,000 Early Childhood. Your research initiative was $105,000. As I'm looking at this, it looks like we're spending more money on adolescents than early childhood and research altogether. I'm not saying we don't need to get our adolescents out of the gutter because they're in the ditch, we need to pull them out. But it seems like to me we might not be focusing nearly enough on getting it nipped in the bud. So can you explain adolescence versus focusing almost nothing on early childhood and dyslexia?
I do want to make sure that I point out, so item 5, the professional development, that links to the budget item of reading recovery. So the teacher sites for reading recovery, and that is $500,000 of this particular contract. And so CCLD focuses primarily on that particular support for teachers across our state, in addition to the other early childhood efforts that are provided with that $50,000. The Adolescent Literacy Project actually matches up with line item 7 in the contract. And so that is their efforts to really bridge the gap between early learning and as students move into adolescence and into middle school, which is another, if you are familiar with our test scores within our state, that's another dip that happens for students. That's a difficult transition. So much of their efforts also go to meeting that adolescent bridge and transitional period as well.
I appreciate the effort in addressing bridges and gaps, but I would suggest that we wouldn't have those gaps if we weren't focused so much on reading recovery and rather just on reading starting. Because if we had the early childhood and the dyslexia initiative securely sealed, we wouldn't need to recover anything because they would have already had it at the first place. So I think we're in a transition point right here. We have to get these things covered. I don't think this is doing it well enough, but I want to certainly will continue this conversation as we move into things, and perhaps our KRS needs to be adjusted to refocus. I know we had a bill in the Senate last year that started to get at this. I know it's been multiple years, has not gotten all the way there. I'm not sure that bill got there either, but I think we've got some really good people in this state. Look forward to putting this together, maybe bring it back to the body this year to help you all have a little better laundry list to work off of. Thank you.
Thank you as well.
Any other questions, comments regarding this contract? If not,
Mr. Chairman, were you wanting me to do 54 and put them together in a motion, or were you wanting to approve separately?
they look different, so I think I want to go ahead and act on this one. And,
Sure.
Okay, so is there a motion to approve? 43, yes.
I move we approve 43.
Motion, is there a second?
Second.
There's a motion and a second. All those in favor of the motion vote aye. All opposed vote no. Clerk, please call the roll.
Senator Hornbach, Senator Southworth,
Aye.
Senator Yates,
Aye.
Representative Bowling,
Yes.
Representative Hart,
Yes.
Representative Mentor,
Yes.
Representative Cook,
Yes.
Chairman Meredith.
Aye, motion carries. Now let's move on to 54, if we could, Senator.
Okay, thank you, Mr. Chairman. My main question on this is in the goals and deliverables on task one, one of the items says work with KDE to identify and invite AP and RC committee members. I'm curious what the structure is that we use to decide who we want to invite to be these members, and how does a contractor help KDE do that, or does KDE mostly hand them the invitation list?
And I'm happy to clarify that. So this again is grounded in KRS, so KRS 158.6453, which details a very specific process around the generation of this advisory panel and the review committee. And so the KDE puts out applications, which we take great effort to adequately communicate that opportunity across all regions of our state, because we feel very passionately that this is important work and we need to curate candidates, teacher candidates, from across the state in all of those regions. And so there is a generalized application that we've used for all of the standards review processes to this point, both for reading and writing, for mathematics, social studies, world language, and others. And so with this process, what we did, once we actually identified the candidates, the communication then shifts to AIR, and they are emailing, they schedule the meetings. So they do more of the logistical work in contacting those particular candidates, but the KDE actually curates from the full applicant pool who will be the best candidates related to elementary, middle, and high school for the AP, and then also that review committee.
Okay, so I have a question. The applications, is KDE just decide what they want in the applications and that's what goes on them, or is there any you'll have to help me out because I don't have the KRS memorized. I do know the process generally, but this is granular.
Sure. And so the KRS doesn't specify specific questions that we must have within the application, but it does ensure that we are pulling from public educators. They must be classroom teachers within the particular content area across each of the grade bands. So we have to have elementary teachers, we have to have middle school teachers, and we have to have high school teachers in this particular case who are familiar with the existing science standards and who are teaching those particular classes. And what we've utilized, and this has been presented in our binder for Interim Joint Committee on Education as well. So all of that is made available to legislative committees, and I would be happy to give you a copy of the application that goes out to curate these applicants. But we have maintained consistency across all the content areas so that there is fidelity to the full process based on that application. So again, we have generated the questions, but we try to ensure when we are selecting those candidates that they do have current classroom experience, that they have at least 5 years of experience within the classroom, and also that they are pulled from across the 8 educational cooperative regions.
Okay, so another question I have. This year, the General Assembly laid down new guidelines for the Board of Education. Not only did we need to make sure that people were representative of the different areas of the state, we also required that there was gender equality and partisan equality. Are those factors that go into the pools here from the applicants? Do we ask those questions and then choose somebody that is going to fit with the you know, to make it actually representatives, I guess, those criteria?
And I will say we do try to ensure that there is diversity among all of the panels, certainly with gender and other areas. We do not ask specifically for any sort of political affiliation because, again, as the KDE, we're looking specifically for teachers who have expertise in the content area. But that's not a question that we specifically curate, nor could I even tell you the political affiliation of all of the AP and NRC members. But I think that when you see the credentials of the candidates, that you would know that we have an impressive body of teachers who are dedicated to this work and understand the importance of curating high quality academic standards for Kentucky students.
Well, I entirely agree with that in theory, but let me rewind to the last time the science standards were created. We had a situation where the majority opinion of this body in the General Assembly found those standards deficient. Mm-hmm. And what had happened was the previous legislative session, they would not pass the new bill, and then Governor Beshear had the legislature bypassed and did it through administrative regulation. And the legislature found the administrative regulation deficient. And then the saga began. And what happened was, of course, the administration implemented them anyway. The Board of Education was obviously putting something together. There was all kinds of community backlash and different things. Some people were for it, some people were against it. Frankly, reason I know this because I was vehemently opposed to removing hard science. We don't have enough science in hard science in our classrooms. The last thing we need to do is get less. But this advisory panel and this review committee concerns me because we are in a situation right now where we can say we don't want to be political, and I don't want to be political. I'm the most transpartisan person there is probably up here. But we know that these things are actual factors. When the deciding people are political, it becomes political. And the reason we need things like the Board of Education to be nonpartisan or equal partisan, not saying they have to be nonpartisan, but equal, to give some kind of balance. We do the same thing with our Board of Elections. And if KDE wants to make that a best practice, then we don't need to pass a law about it. But if KDE doesn't want to make it a best practice to ask these questions, then it may turn into a situation where we're just going to have to make it happen. And so I would offer that to KDE to think about, given the situation that we're in light of, our current society. We need to be mindful of those things. Everybody wants to be mindful of certain diversity, and sometimes other diversity wants to be thrown to the curb, and we need to remember all of it. That's all I have, Mr. Chairman. Thank you.
Any questions or comments? If not, entertain a motion to approve.
So moved.
Motion by Chair Cook.
Second.
Second by Representative Mentor. All those in favor of the motion vote aye. All opposed vote no. Clerk, please call the roll.
Senator Hornback, Senator Southworth.
Explain my vote, Mr. Chairman.
Yes.
I'm going to vote yes because these science standards have got to be revised. I really hope that it's not more of the same. If this body puts out something that's similar or more of the same, you can bet I'm going to be on the front lines fighting it. But if this body will actually do robust research on science and instead of some of the other stuff that's been added in, then that would be wonderful. I'm not sure if that's going to happen, but I really encourage us, the KDE, to get a really good panel that can focus on the education part of it and not on the politics part of it, so that we can all be better off for it and our kids will actually learn things like how anatomy and physiology works and how biology works, how chemistry works. If we all knew more about these things, probably a lot of us would have been able to take care of ourselves and our loved ones in time of great sickness instead of having to just rely on the total quagmire of information available out in public. Thank you.
Senator Yates.
Aye.
Representative Bowling.
Yes.
Representative Hart.
Yes.
Representative, Representative Mentor.
Yes.
Representative Cook.
Yes.
Chairman Meredith.
Aye. Motion carries. Last contract for this department is number 55. And again, Senator Southworth has questions, as do I. Senator Southworth, I'll let you proceed.
Well, Mr. Chairman, I guessed that you may have questions, and I'm not going to ask your questions. I really want to get a handle on what is this, because it's so vague. I'm not entirely sure what's going on. All I caught was the teams, putting together these teams, and somehow someone in San Francisco is going to be able to help us get an identifiable brand, including name, logo, and tagline. I talked about logos earlier. What do we need a logo for when we're talking about public education? I'm pretty sure everyone already is aware and on board.
Would anybody like to address that?
I can simplify it with the very first part of the question is exactly what is this?
Senator, I have David Cook and Karen Dodd on.
Send me David Cook. He can explain things well.
All right. You're up, David.
Thank you, Senator Southworth. I'm not sure if everyone on the committee is familiar, but over the last 6 months or so, the Department of Education has been doing several things, one including a listening tour of the constituents around the state about where education is in Kentucky at the moment and where people would like to see it go. From that, we created a statewide coalition made up of all kinds of different stakeholders that was looking at that information that came from those listening tours and sort of developing reports about that work, about the current state of education and the future state of education. And then as part of all of that, there was the overarching idea, Senator Southworth, is that we're looking at what about the future of education needs to be different, in particular around the areas of assessment and accountability, because we know that there are a lot of different delivery methods of assessment and accountability systems that we've seen around the country that are successful, and wanted to see what that looks like, and then most specifically, what does it look like at more of a community level rather than the state sort of dictating all of these things at our level, but rather asking the communities what they think they need to look like for their graduates and pulling that together and pulling it up to the state level. So we've been involved in a process over the summer to get that started. These local laboratories of learning are communities that raised their hand and said, we'd like to be initially involved in this work. And so this contract is to support that work. And if you look into the depth of the contract, the work is almost exclusively being done by the Center for Innovation and Education, which is was at the University of Kentucky until very recently and is now a Kentucky-based nonprofit that works out of Lexington, but they separated from the university fairly recently, and they have been providing the leadership and the work along with. And by the way, I apologize, Senator Southworth. I'm David Cook. I'm the Director of Innovation at the Department of Ed, and my team, my division, has been primarily responsible for working with the Center for Innovation and Education to actually get this work done by identifying leadership in these communities, both at the school district and in the community. So we're working with Chamber of Commerce people. We're working with local legislative people, also, mayors and county judges who are also involved in this process to spend time thinking about what local communities need in assessment and accountability and in education in general. So the contract is to support all of that work over an extended period of time.
You said some of the communities raised their hands to volunteer to be the first ones. Do we have a list of those?
Yes, I can get that to you. I can name, there are 7 that are actually beginning the work right now. Those are Jefferson County, Allen County, Frankfort Independent, Fleming County, Johnson County, Logan County, and I'm leaving one out. Somebody else, I hope there's maybe some.
Somebody's long lost child. Yeah, well, that's a good that's a good start on the list, though. And I appreciate the idea. What I guess I'm going to go to next, and then I'll turn it back over to the chairman, is how a contract with somebody in San Francisco is going to help KDE get more granular on the local input.
Right, and I'm going to defer a little bit to Karen on the intricacies of contract administration and how fiscal agents work. We have not had any interaction as my team. All of the work is being done by the Center for Innovation and Education in Lexington. The contract is with a corporation, a nonprofit in California, that center, the Tide Center, does this kind of work. They sort of act as fiscal agents, pass through organizations to whoever is doing the actual work. So they contract with the Center for Innovation and Education locally, and they do the work with us. So all of our interaction has been with a local corporation in Kentucky.
Okay, so that helps me in one sense. In the other, then it raises a giant question. What's the point of the middleman?
That's not my area of expertise. I will defer to someone else because I just know who I'm working with. So,
Senator Southworth, this is Karen Worth. When we worked with Jean Wilhoit, is actually the executive director for the center. Their concern and their main drive is the task at hand. They don't have the staff and the ability or the want to actually deal with the fiscal side of it. So they partnered with this Tide Center in California for them to manage the fiscal side of it. I can't speak on their thinking on why they choose not to handle that part in-house, but that is the direction that we were given when we established the contract.
I believe my next question is going to be synonymous with the chairman, so I will defer to him to finish his question.
Well, actually, your question opens up a new line of questioning for me. First is, was there an RFP for this contract?
No, there wasn't, Senator, because it's a nonprofit organization. Both the Center for Innovation and Education and the Tide Center are nonprofits, so we can function under a memorandum of agreement. We don't have to do an RFP for this process.
You don't think there's a possibility that someone else could do this work as well, if it's not better, and that there could be groups here in Kentucky that could provide this service?
I think we have a group in Kentucky that's providing this service. They just decided to have the physical aspect, the administrative part of this contract handled by someone else who does that as their business model. The Center for Innovation and Education is a Kentucky-based nonprofit, and all of the work, every part of the work is being done between the Department of Ed and the Center for Innovation and Education.
I appreciate that, but that didn't give me a whole lot of comfort. If we're not bidding this thing, we're spending close to $500,000. How do you know whether that's a good price or not?
Based on what they're doing for us, it's a very good area in terms of the cost of it. And I know that most agencies in the state enter into a lot of memorandum of agreements with nonprofits. So the process we used was exactly the process we're told to use. So
I appreciate that, but you just identified a new gaping hole for me in that this whole Chapter 45A process, that if you're not for profit, then you don't have to be held to any financial accountability for this. And I've got a real problem with this. I think there's other folks that could provide this, should provide this. There should be an RFP, and the fact that this is we're doing this in our MOA is not justification of me just not to scrutinize this and spend the dollars as wisely as we possibly can. So I can tell you, I've got groups in my 6 counties that I represent that if you said we're going to give you $500,000, they would be ecstatic to have access to those funds for reasons I can show you. We could generate some return on investment in this one, just like it increases more bureaucracy. And the other issue with me is that it's from a California-based company, and I'm not going to bore our committee members with my version of that again, but I don't think we should be doing business with companies in California. I just want to have confidence this is a good contract. Co-Chair Cook, you have a question, comment? Oh, excuse me, Senator Southworth.
Mr. Chairman, I was just going to follow up here. I'm glad that you pointed out the things that you did, because I can appreciate someone who wants to do education innovation and not have to fool with the papers and the money and the admin part of it. So that is established, makes total sense, and I would like communities to be more heard, and I was glad to see the listening tour going on. I think there's a lot more there that probably needs to get added in, but I won't necessarily make that a focus. My main focus at this point is I'm aware of the economy in San Francisco, where this company is located, that's charging us a non-bid amount. And typically when we see these contracts or whatever for review from California, they've actually gone through the bidding process, beat out other competition even locally, because they have scaled it to the perfect sweet spot and they're able to run things through faster, or whatever reason they're cheaper. And so for the taxpayers that we represent, it's a better deal. And in times I've not been opposed to supporting a San Francisco company. However, in this case, because there was no bid, we have no idea how much local Kentucky admin operation would charge us. And San Francisco's economy is significantly higher cost of living and therefore significantly higher wages than Kentucky. For example, I had a friend who just moved there, and I said, when you're considering doing this, you need to look at the differential, because if you think you're taking a job that pays $20,000 more, it actually pays you less when you do all the math. So he did the math, and it turns out that the differential was about $25,000. So he needed a job that was going to, push him, $40,000 more just to make it worth the while. And he did, and that's great. But when we're paying in Kentucky $478,000 to San Francisco, I'm wondering if in Kentucky it would cost $378,000. That's the question.
So, Senator Southworth, can I respond?
Yes, please,
Chairman. I think it's important to remember that the administrative cost of this contract doesn't change regardless of it changes based on the amount of the contract, obviously, but it's a percentage of the contract. So the Tide Center gets what they get based on the size of the contract. Again, the actual work is being performed by a Kentucky corporation, and they are the ones actually involved in the services themselves and who provides those services, not California. So Gene Wilhoit and his organization are providing the services and the people who do them. So it's not the only thing that's happening there is someone is probably being paid from the Tide Center budget using the administrative amount of this contract, which
Are you suggesting this is the 26% that we're seeing? That
It's 40. No, it would be 40. It's 43,000 is what the administrative cost that goes to the Tide Center.
43,000.
Right,
Yes.
43,000 of the contract is to the contractor. The rest goes to services provided by the Center for Innovation and Education.
So you're saying
If you
these folks are middlemen.
That's what they do, Senator, is they provide, that's what their organization does, is provide these kinds of services to manage the contractual obligations without actually doing the work. That's what they do.
And there's no one in Kentucky that can do this.
Everything is being done by Kentucky. They're just not, the Kentucky Corporation is just not handling the interaction between the state of Kentucky.
I appreciate that. I understand that. I hear that, but you're saying there's no other group in Kentucky that can serve this middleman function.
I don't know about the middleman function, sir. I know that this organization that's doing the work for us is well respected in this area of work.
Okay, let's back up. I'm sorry, Mr. Chairman. I was going to follow up with my earlier question.
Feel free.
Let's back up because I feel like we either have something wrong here or I'm missing it, but I'm in the contract right now, and it says that the contract is with Tide Center and that the total amount is $478,850 and that the breakdown, they've got $60,000 for communications, $168 for the stipends for the families and the funds for the local support and so forth. Topical experts, $37,600. Staff time, it says each category includes 9% indirect that goes to our fiscal sponsor Tide. So you saying that the 478 is a total of the 100% of the project plus the 9% of indirect, and that Tides is getting the 9%, and that the contract, though here it's written that the whole thing's with Tides, so they're a flow through for the money to the innovation group with Will Hoyt. Is that accurate?
478,000, Senator Southworth, is the total of the contract. 9% of that is what's going, 9% of the 478, which Karen just mentioned a moment ago, was 43,000, whatever that is, goes to the Tide Center. The balance of the contract goes to the Kentucky Corporation, CIE, that Gene Wilhoit is the CEO of.
And so Tides is a flow through for the rest of the contract money going to Innovation Center. I caught that now. So now the final piece of the puzzle is kind of the original piece of the puzzle, and that is there not a Kentucky company for, economic incentive, improvement, development, whatever you want to call it. Usually we try to stay local if we can, buy local. Kentucky obviously is ideal to keep as much money as we can. We'd rather bring money in, not sending money out. So the big question is there a nonprofit in Kentucky that could be the 9% person for the Innovation Center?
Karen, you want to address that?
I believe that would be a question to the center. That was their decision as to who their fiscal agent was.
So this is
who they decided to work with.
Someone they work with often?
I would say that is probably true they do contracts with other states besides Kentucky. The Center for Innovation does. They're a Kentucky-based company. I would assume with all of their contracts, they use an external partner to handle administration, and it's quite possible that they use this same organization for other contracts. So
And-
they do other contracts that also benefit Kentucky because they're money coming into the state of Kentucky.
And we appreciate that. So my final closing remarks, Mr. Chairman, would be that we appreciate the Innovation Center bringing other companies into Kentucky, and we understand that from their perspective, they're looking for the best vendor. However, they do need to understand when they're using taxpayer dollars. From our perspective as the watchdogs on those spending of those funds, we want to keep the money in Kentucky. And we may not have the exact same mission statement, but I think a little bit of research, perhaps we could find something that works out. I certainly hope that we can keep as much money and or bring as much money as we can. If they weren't using this person in California on all those other contracts they're bringing in, that'd be 9% more staying in Kentucky, even from our out-of-state contracts. That'd be fantastic. Thank you.
To that end, we have obviously a lot of questions about this and a lot of reservations. Would there be an issue if we defer action on this so we can become a little bit more familiar with what we're trying to accomplish here?
Mr. Chair, I just had one question still. I didn't want to interrupt.
Fire away.
Oh, thank you, Mr. Chair. It was appropriate. Some of the questions with nonprofits coming out, and I know locally dealing with a lot of nonprofits, a lot of times the administration can be the part where you have the mess ups. That when there's money passed through, and I understand that they'll send it through the Tide Center, and the Tide Center will distribute those funds, and there'll be a responsibility there too. And then the 9%, I guess it's kind of in the range that we see a lot. In what you've done, have you seen other organizations that do these large scale administrations for the nonprofits here locally and other bids?
I haven't, and I've not done a lot of these large scale bids, Mr. Yates, but I don't know about the Kentucky-based corporations that do this for their living. So,
okay, and I know with these type of administration, a lot of times, even if it's set up as a lot of times they'll set up the LLC or where at, and then they because so much of it with technology, people live all over the United States, really all over the world when they're putting these costs out. So what used to be, we used to say if the company's located in California, therefore they're going to be more expensive than other places. We've learned that that's not always necessarily true because of technology. Sometimes these large scale companies, they're just able to do it cheaper. And I know that sometimes when we're wanting to be good financial agents and fiscally responsible for our nonprofits, we want to make sure that there's not lost money on those costs. What could happen, and I'm sure it'd be really simple for a local guy to open an LLC here in Kentucky, bid on this, get it, and then contract it out to Tide Center as a pass-through, take a couple percentage off the top, and we'd all feel happy that we could say it was Kentucky, but we know that money would really be going outside, and that's one of the problems you have when people can just open up corporations anywhere. I'm thinking that the question is to really, with the nonprofits, if they've looked at other places, and I know that sometimes we don't micromanage all the way down into that, the weeds of it, but I'd like to know, just as being new to the committee this past year, is that do we get that kind of behind the curtains look at who all, when we have these non-competitively bid contracts or these, when they choose these sole source contracts, who else they've considered? Would you have that in your notes? And I think that's probably what the committee's going to ask if there's a problem for you to look at. And before we go there, I want to see, would that be hard information to get?
No, we could definitely look into that.
Thank you.
Thank you, Senator Yates, and I really feel it's probably the consensus of this committee that we would like to see that information. So to that end, my preference would be to defer this contract if there's a motion to that effect.
Motion, Mr. Chairman, to defer, and the purpose of getting the information on who else they've looked at and or who else is available, so we are aware of it, so that we can make a more informed decision to know whether they, should be able to move forward with this or whether we need to be putting the brakes on. Thank you.
Motion to defer. Is there a second?
Second.
Is that
Representative Bowling?
Representative Bowling? Thank you, sir. Appreciate that. Motion second. All those in favor of the motion vote aye. All opposed vote no. Motion to defer. Clerk, please call the roll.
Senator Hornback, Senator Southworth,
Aye.
Senator Yates,
Aye.
Representative Bowling,
Yes.
Representative Hart,
Yes.
Representative Mentor,
Yes.
Representative Cook,
Yes.
Chairman Meredith.
Aye, motion carries, and appreciate y'all's time this morning. Look forward to discussing with you in further more detail in our next month's meeting, October.
Thank you.
I believe. Thank you. Next item on the pull list is Kentucky State Police, and is number 61 on the routine MOA pink list. If representatives are here, please identify yourself for the record.
Yes, sir. Captain Don Wilson, Finance Grants Management Branch for the agency.
Anyone?
This is Amber. Sorry.
That's okay.
This is Amber Burr with, I'm the fiscal manager here at the Financial Grants Management Branch with Kentucky State Police.
Thank you for joining this morning. Co-Chairman Cook has questions about this contract.
Thanks, Mr. Chairman. We don't always pull contracts because there's a problem with it. Sometimes we pull contracts because they're doing something good. And if you all could just talk about this for a minute or two, explain what you're doing, and then I have some comments to make.
Yes, sir. This is a kind of a multi-based program, I guess, that we've incorporated to help with our recruiting, and in a way, I guess benefits the Commonwealth itself. This began in 2018 with our cadet class 96, and it provides the Commonwealth with the opportunity to earn an associate's degree by completing 15 or 5 core classes, and then the training that we provide at the academy covers the rest of the 60 hours required to obtain the degree. I'm not sure what information you're wanting up front here. I apologize.
No, you're fine, Captain. And the reason I caught this, and this caught my eye, and I'm so interested in it, is because 20 years ago, I had a professor, I had an advisor at the University of Kentucky who thought outside the box, Dr. Lori Garkovich, and I was able to get college credit hours when I went to OCS, and she took leadership training and history classes and stuff that went into it, which helped me go and get my degree. This is promoting education, and this is something, and that's why I asked the earlier group to stay on and listen. If they're interested in talking about veterans, police, you can go across anything, and they get such good training and such good classes. They go across such a wide variety of topics that we can very much apply those towards getting degrees. So I applaud you all for what you're doing, and I encourage our universities out there to look at our technical schools, to look at the military, to look at these other programs that are going on, and to think outside the box on how they can help apply. Because if they can get 6 credit hours, 12 credit hours, applied with that, it will help promote those people to go on and get a degree. So I just want to congratulate you all for what you're doing and setting the example. Thank you.
Appreciate it, sir.
Certainly want to commend you as well. This is thinking outside the box, and it's kind of what we alluded to earlier. We know we have issues with workforce and development, and there's a lot of different ways to approach this if we'll just take that initiative and do it. So I commend you for trying to plug this particular hole. And we know it's quite significant, and I think it's a good investment in dollars. And Co-Chair Cook, I appreciate you bringing this to our attention. You're so correct. If you want to learn how government works or doesn't work, be a member of this committee. You can find out. And this is an educational process for us, and I always appreciate those opportunities. If there are no other questions or comments, entertain a motion to approve.
I move to approve number 61.
Motion, is there a second? Second by Representative Hart. All those in favor of the motion, vote aye. All opposed, vote no. Clerk, please call the roll.
Senator Hornback, Senator Southworth.
Aye.
Senator Yates.
Aye.
Representative Bowling.
Yes.
Representative Hart.
Yes.
Representative Mentor.
Yes.
Representative Cook.
Yes.
Chairman Meredith.
Aye. Motion carries. And Captain, appreciate you being with us this morning, as well as Ms. Brewer.
Yes, sir. Thank you all.
Next item on the pulled list is number 64. It's the Office of Health Data and Analytics. It's on the routine MOA pink list. If representatives are here, please identify yourself for the record.
Hello, this is Kim Mentor with the Cabinet for Health and Family Services in the Office of Health Data and Analytics, and I'm a staff assistant with them.
Good morning. I'm Brandy Janot, and I'm a program manager for the Kentucky Health Information Exchange.
All right, Central Southworth has questions for you.
Thank you. I see here it says we're giving the opportunity to apply for an incentive to offset the vendor fees associated with connecting to KHIE. Can you explain a few examples what the vendor fees are, their actual total costs?
Yes, that actually varies per vendor. It's a really wide array. Unfortunately, some vendors charge extraordinary amounts of money while others don't. To connect to the Kentucky Health Information Exchange on our part, of course, is free. We do not charge for these services, but we found that over the years, I've been with the KHI for over 9 years now, and the repeating hurdle that we keep seeing is that especially the small clinics and the rural clinics, they just don't have the funds that they need to make that connection. And so this was our attempt to fill that gap. So we requested money, of course, funds from the federal government, and to offset this cost and to pass that savings on to the pharmacies, hospitals, and clinics across the state.
So you mentioned that some vendors charge extraordinary amounts and others don't. Is there a list of, like a blacklist of vendors that we don't want to pay grants toward because they're overcharging anyway, or how does that work?
We actually don't have that information. That's actually based on the providers get that information, and I'm sure they shop around. And what I may consider extraordinary may not be what somebody else does. But I think that connecting to KHI is very beneficial and should not cost as much as it does.
Give us an example, just a couple of different examples. Is it size, scope, type of the practice, or what are the factors that create this cost? And just, it doesn't have to be evidence-based data, but just anecdotally an example of what kind of costs we're talking about, because these grants are for $15,000 for hospitals or pharmacies, $8,000. There's other categories, but I'm just wondering how much of a percentage is this of the total, and is this an annual fee? I mean, we need a little better. I'm new to the granular details of this system. I'm not new to federally funded programs that I typically hate to see federal grants coming down incentivizing stuff that frankly makes no sense for small businesses. So that's where I'm kind of trying to get this figured out.
Yes. So I was working with a provider the other day and found that their vendor was charging them $10,000 per connection to the public health registries. So if they were going to connect to the immunization registry, that would be a $10,000 fee. And if they were going to connect to syndromic surveillance registry, that was going to be, they cut it down, I think, to $5,000. So in order for them, for that particular provider would offset $8,000 of that.
Okay.
Does that answer the question?
That does help. How many registries are we talking about then? Because it sounds like this isn't just one connection. This is a lot of different connections.
This is based on, yes. So this particular incentive was for any type of connection to the Kentucky Health Information Exchange. So if it could be any one of the public health registries, it could be what we have, just the data, to submit data, CCDs, or bi-directional exchange of health information. So it covers an array that way that we can help fill the need of whatever they want to do.
So I checked with my pharmacist last week when I had a question regarding the immunization registry, for example. And what I found out was in these new COVID vaccines, if you're going to administer, you're required to be a member of the registry. But for other vaccines in the past, it wasn't a requirement. So are you suggesting that a small business would want to pay the fee to get on this immunization registry? That's an optional thing anyway. Why would you want to jump through that hurdle? I'm not sure of the reasoning.
Okay. Trying to think of the best way to explain it. So as far as the immunization registry, I think there are some guidelines that pediatricians and things like that have to go through across the state. They do have the option to enter into that immunization registry manually. But what KHI does is we provide a more automated service. So there's less man hours trying to key in that information directly to the immunization registry. We can pull that data from their EHR, electronic health record system, and kind of tunnel it to the public health immunization registry.
And final question, how many public health registries are there?
I think there's currently, we have the syndromic surveillance registry, which goes to the CDC, and that helps them to see hotspots for different things like the flu and COVID. We have the immunization registry, we have the electronic lab registry, and then we have a few clinical registries too. So we are starting up an advanced directive registry, just to name a few.
So would you say they're total under 2 handfuls amount of all the registries?
I'm sorry, I didn't understand the question.
The number of public health registries, you listed off like 4 or 5 things. So, and then you said a few others. So is it all total like within 2 handfuls as far as the number of public health registries?
Yes, those were the larger ones and the most common. And then the providers also, there are federal, I guess, objectives and measures that they have to follow as well. Excuse me, for the MIPS program, they have to follow some of these guidelines too. So it actually helps them meet those objectives and measures as well.
I see. Okay. Thank you for your answers. There's a million more rabbit holes I'd love to go down, but that's definitely for another day.
Oh, thank you.
Representative Bowling, you have a question?
Yes, thank you, Mr. Chairman. My question is, I understand the grants. How are they administered? Are they administered on the front end so they can go after these, so they can get registered in these programs, or are they given once a provider has already gone through the process and proved they've completed it?
They're administered on the front end. We found that would be more helpful, especially for the smaller providers that really don't have that money up front.
Okay. And what happens if they apply for the grant, get the grant, and then do not go and complete the process of getting enrolled?
Then they would have to return those funds back to the cabinet.
Okay. And how are we checking on that? And I just don't want to see a thing where, $15,000 grants, 8,000 grants go out there and we only have, 60% of the providers that actually go through with it. I want to make sure there's a good mechanism for verifying that and making sure we get back the funds that are not used for this purpose.
Absolutely. Absolutely. So at the conclusion of the program, and that I believe is June of 2022, pardon me, they have to show itemized statements showing exactly where the funds were spent. And if they weren't spent correctly, that they will have to return those dollars.
Very good. Thank you.
You're welcome. Thank you.
Thank you, Representative Bowling. Any other questions? Not entertain a motion to approve? An enthusiastic motion by Representative Hart. Is there an enthusiastic second? Second by Co-Chair Cook. All those in favor of the motion vote aye. All opposed vote no. Clerk, please call the roll.
Senator Hornback, Senator Southworth.
Explain my vote, Mr. Chairman.
Yes.
I'm going to vote no. I am entirely concerned about, one, I mentioned federal grants. Not a huge fan, particularly when it doesn't relate to something that should be federalized, which is somebody's individual health care and health practice. Now, I know there's a lot of bureaucracy around this whole thing that has kind of created this problem, but now we're spending more taxpayer dollars trying to get everybody up to speed on, frankly, a whole lot of paperwork that would be a lot easier if we didn't do. I've sat through Homeland Security reports on where the flu numbers are, and I find them entirely uneducational. If anybody wants to know, where the flus are or where the COVID is, just look around. I mean, it's everywhere. It's invisible. We can't even put our finger on it anyway. And the immunization registry, it's voluntary to get into. I don't see why we need to be putting taxpayer dollars toward incentivizing people to get into something that's entirely voluntary in the first place. It's obviously not a required thing for a business to operate in the current environment even. And so in a number of other items, I just don't see that this is best use of taxpayer dollars, so that's why I'm voting no.
Thank you.
Senator Yates?
Yes.
Representative Bowling?
As a provider, a pharmacy owner and provider, I'm going to abstain from voting.
Representative Hart?
Yes.
Representative Minter?
Yes.
Representative Cook?
Yes.
Chairman Meredith?
Aye. Motion carries. Thank you, folks, for being available to us this morning. Last contract we have up for review and consideration. And I just want to encourage committee members, we still have a couple of exemptions we need to act on, which should be short order, but the last agreement is number 2 on the MOA Amendment 10 list, and that's with the Attorney General's office. If representatives are here, please identify yourself for the record, and Senator Southworth has questions for you.
Good morning. My name is Amy Burke. I am the Assistant Deputy Attorney General over the Criminal Division. My name's Robin Diezdo. I'm the Deputy Director of the Office of Victims Advocacy and the Kentucky SAGI Program Manager.
Thank you for joining us this morning, Senator Southworth.
Thank you. Thank you for your patience sitting through our entire committee meeting. I have a question about the genealogy searching. What is the genealogy searching for, and why are we looking for familial portions of the case through the DNA database?
Sure. Thank you, Senator Southworth. So what this essentially is the SAGI grant dealt with the backlog of sexual assault kit initiative. So if you're familiar with how they solved the Golden State Killer case, he was a serial murderer rapist who operated in the 70s and 80s. It was done through familial genetic genealogy. And so what SAGI has increased and what this specific...
Right, their half of the grant. Okay.
What this specific grant would be about is for the state of Kentucky to utilize that method of testing in order to work on cold cases to identify both victims and both offenders. For cases that have occurred within or every jurisdiction in Kentucky, as well as to kind of loop in this whole SAGI network nationwide in order to do that familial genetic genealogy testing. I can't speak exactly to, and Robin can a little bit better, as to what that testing specifically is, because I know just enough about it to be dangerous. So I'll let her take that part of it. Sure. Okay. The grant funds, what it really is it's a scientific enhancement of investigations. The grant is 100% fully funded by the Department of Justice and the Bureau of Justice Assistance to fund this forensic genetic genealogy, which we call FGG. So, for example, FGG is a huge law enforcement tool for multi-offense serial offender cases that we have the funding to now use in Kentucky. It can help with sexually motivated cold cases as well as sexually motivated cold case homicides. So it's something that we use to further all of the investigations.
You might be familiar with CODIS, which is the FBI database. That's one of the best toolboxes we have for investigative leads on these cases. But even further than that, what we now have access to is this genetic genealogy that provides this powerful new tool that generates even further leads that are associated with relatives that we don't have access to with just our conventional testing or conventional investigative strategies like fingerprints and eyewitness statements. So it's a really great innovative tool for law enforcement.
I'm sorry, Senators. I think to put it very oversimplified, it will complete the DNA chain where there's certain markers that are missing. It will use this huge database of, I think, these genealogical studies to, if they can locate different relatives, to complete the DNA sequence so that that can be tested. I think that's a huge oversimplification, but that's my understanding a little bit of it.
Well, that helps go where I was going, I think. So CODIS used to say they use 13 markers. Are you saying there's going to be more than 13 markers, or we're investigating some of those markers because they actually have familial information, even though in the past decade we've been told they don't?
No, I think I got you confused. That's not what it said.
Okay. Maybe start over.
So CODIS is the first step that we use. These cases don't qualify for FGG unless there's first a hit in CODIS. But when it hits to a suspect in CODIS, the suspect has to be unknown. So we know that there's DNA, and that's often how we see that these are serial cases. For example, there's a case that we're working on in Kentucky that through CODIS hits, these cold cases have hit to six different cases have hit to one unknown suspect that's in CODIS. And so then the further step is, okay, who's the suspect? We use the FGG to then do the genealogy or phenotyping or ancestral analysis to then be able to hopefully identify who that suspect is.
So are you saying everyone that uses Ancestry.com can be compared to figure out who their family members are and narrow down who the suspect might be?
Yes and no. So some of the public databases aren't accessible to these law enforcement searches, but some of them are. Two of the main ones that are used are GEDmatch and Family Tree DNA. And so yes, those public databases, when you submit your DNA to them, then you agree that it can be searchable for your family members.
Thank you for connecting that dot that I've been working on for a decade.
Mr. Chair, just
Senator
to follow
Yates,
up.
you have a question? Yes, please.
Yes, Mr. Chair. Thank you. I put the little, I don't know if you could see in the top left hand of the screen, the little hand up there.
I see it now.
All right. I don't know if that's helpful or not. I was on Megan's law team when I was at the AG's office, and I was Assistant Attorney General, and we did sex offender prosecutions, and that was a long time ago before we had this information or technology. But my understanding of the FGG, the forensic genetic genealogy, it also helps kind of get an idea of what kind of suspect we're looking at, right? Like if it would be a white male, or I guess you could already tell it's not male, but if you could say that they're from this type of background, or they're likely to have these type of attributes. So it also helps narrow that search and lead out suspects. Is that correct?
Yes.
Okay. And then, but can it go a step further when you're able to look at it and say, but I think that this suspect could be related to John Doe from Louisville, Kentucky?
Yeah, so ideally with this, so there are different steps and different things that these advanced DNA analysis can do. One of them, I think what you were first talking about, is the phenotyping, and that can actually develop a picture or a profile of somebody based on their DNA. So it's actually helpful, so you can compare, and they're pretty accurate when they do that. Then for the genetic genealogy and the further ancestral analysis, it can really narrow down a suspect to a region, a family, or even an individual. So you could find there are cousins or a second cousin or third cousin that's in this specific town in Kentucky. And so you go and you start with the cousins, and then you can get further reference samples to get closer and closer to your matched DNA.
Thank you.
Sure.
Thank you. Fascinating subject, quite an education. And I think there was recently a news story about a gentleman that was a 40-year cold case that through a family member doing their DNA, they were able to track him down. And so you can run, but you can't hide anymore. Yep. But thank you. Any other questions, comments? Not entertain a motion to approve. So moved. Motion by Co-Chair Cook, second by Senator Yates. All those in favor of the motion vote aye. All opposed vote no. Clerk, please call the roll.
Senator Hornback. Senator Southworth.
Explain my vote, Mr. Chairman.
Please.
Mr. Chairman, I'm voting no. And for those who know my history of working in this body way before I was a member, it should come as no surprise. In 2013, there was a Supreme Court case, and Justice Scalia wrote a decision, Maryland versus King, about the Fourth Amendment concerns relating to cold case searches in the CODIS database. And while I have conceded that those convicted of crimes are giving their DNA now, which I still think needs to be narrowed down to those who are related to the crime, but anyway, that's a side comment. I've had long concern about the federal sweep up of anybody and everyone's DNA as possible, with essentially when these people agree that their information can be seen and searched publicly, they are not aware that they are waiving a Fourth Amendment constitutional right to search and seizure. And so I think there is a major legal issue here. Obviously, we want to catch criminals, but we certainly have to protect constitutional rights first.
Thank you.
Senator Yates.
I vote yes. May I explain my vote?
Please.
I think very much the DNA is up to date as what fingerprints were of yesterday. And as someone who has been in the trenches doing prosecutions of some of the worst sex offenders, I'm excited about the opportunity to protect Kentucky's family, particular children, where I've worked on Megan's law team as well. I think that the more that we can encourage people to be able to freely give over the information, the better that technology will be expanded. But at all times, as you know, Kentucky, we have to make sure that we're cognizant of those constitutional rights. And so I do very much always adhere to my colleagues' comments in council. And I know this has been an ongoing long debate, but I think as technology improves, so does the ability of law enforcement to be able to better protect. And while there is that balance, I think this falls squarely into the right. So I vote yes.
Representative Bowling.
Yes.
Representative Hart. Representative Minter.
Briefly explain my vote, please.
Yes.
I'm going to vote yes today, but I do have some civil liberties concerns about this. And I think Senator Yates really spoke my mind very effectively. The terms of service for these operations are troubling in, giving people civil liberties away. And I think that's something that certainly at the Attorney General's level, that's something that one could work on as you negotiate contracts like this going forward. But it is a valuable tool. And as Senator Yates said, these are the fingerprints of today. So I vote yes, but I would like to see some work on that to protect some people's civil liberties.
Representative Cook.
Yes.
Chairman Meredith.
Aye. Motion carries. And ladies, appreciate your testimony this morning, and very educational, very informative. Thank you.
Thank you.
Folks, two last items we need to act upon, and that is an exemption request, two exemption requests from the Kentucky Department of Agriculture. And this is a routine that they have agreements that extend beyond our biennial, so they have to ask for an exception for those. You've had that in your packet. If there's no questions, comments, I entertain a motion to approve these exemption requests.
So moved.
Motion by Chair Cook. Is there a second?
Second.
I believe that was
Southworth.
Senator Southworth. We can do this by voice vote to expedite it. All those in favor say aye. All opposed vote no. All in favor?
Aye.
Aye.
Any opposition?
Aye.
Any opposition? All right, thank you. Folks, appreciate your time. Be informed that our next scheduled meeting is Tuesday, October 12th at 9 a.m. Thank you. Yeah. No, you can't. How do you think it'll turn out?